Health ministers from around the world are meeting online for the WHO's annual World Health Assembly. Representatives from all 194 member states meet every year to decide on global health priorities. The Covid-19 pandemic will, of course, be top of the agenda this year. There will be questions about how the outbreak got to this point, with more than 4.6 million people infected globally and over 313,000 deaths. Our global health correspondent Tulip Mazumdar has more.
The World Health Organization is facing immense pressure over its handling of the Covid-19 pandemic, with the US president leading the charge against the United Nations Health Agency. The US is the WHO's biggest single donor, but last month President Trump withdrew funding and launched a blistering attack on both the WHO and China.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death.
The WHO did get teams into China to work alongside Chinese officials in January and February, and says since it was first alerted to the outbreak, China has shared crucial information which has helped other countries prepare. Founded in 1948, the World Health Organization's goal, both then and now, is ensuring the highest attainable level of health for all people. It works on a wide range of life-saving programs, from mass vaccination campaigns to sounding the alarm when international health emergencies hit. But it is just an advisory body. It doesn't have the power to enforce or compel countries to share information. Now, at this year's World Health Assembly, there are calls to give the agency more powers, with WHO inspectors able to go into countries at the start of outbreaks and carry out independent investigations.
The big challenge with outbreaks is that no country wants to have one. Every country wants to deny it's there, and every country wants to play down deaths. Right now, countries are required to notify if there's some kind of emerging pathogen within their countries. They're supposed to notify WHO within 24 hours to this. And so this would be an extension of that, to actually have WHO send an international mission in to investigate the origins of this.
Representatives from 194 countries who are meeting virtually this year will also consider calls from the EU, the UK, Australia, New Zealand and others for an international review of the global response to the pandemic. Another thorny issue at the meeting is likely to be around Taiwan, which has been praised for a very successful response to the pandemic, but is banned from attending because China and the UN doesn't recognise it as an independent state. There will also be renewed calls for equal access to vaccines against Covid-19 once they are developed, for all nations, rich and poor. Tulip Mazumdar, BBC News.